There are several ways for leaders to communicate with their constituents. Two of those communication techniques are transformational and transactional. Transformational leadership style is typically characterized by a leader who attempts to lead constituents by changing the system, promoting capabilities of said constituents, and by leading by example. An example of this style would be Walt Disney. His staff, while he was alive, report that he was a fantastic leader who had ample praise for a job well done, but also commanded respect as a leader, and his staff knew when something was not to his liking. Walt Disney exhibited self-confidence and vision. These characteristics allow him to be recognized as a transformational leader. Constituents of transformational leaders are usually noted to exhibit a strong sense of loyalty, commitment, and job satisfaction. Now, this communication style may sound great, but a major drawback can be that this style is most effective under dire circumstances. When constituents are dealing with limited resources or are put under a great strain. Then they seem to require more motivational leaders, like those classified as transformational. This style is far less effective in good times where there is no added pressure. As an ER nurse, transformational leadership is more effective with communication between myself and my coworkers as we work under constant strain. We always need the little boost of a compliment or some inspiration. Those little "keep going" messages, or "you're doing great," or even some days the "we've only got 3 hours left," they make you feel like you can do anything. They empower you. In a work environment interaction between coworkers, it should be transformational. Making a better and more uplifting work environment, interaction between an employee and a leader should be transactional. Transactional leadership style is concise. There is a reward for productivity, and followers are motivated to fulfill leaders' expectations. Transactional leadership style promotes safety and mitigates risk. Staff performance is generally better under this leadership. An example of this leadership is the military. In the military, messages need to be relayed in a concise and clear manner. Many leaders in healthcare also use this style, and in many cases, it is effective. This, while being effective, does not always make constituents feel appreciated as individuals, and also this style is limited in its ability to address situations with deeper levels. As I had previously mentioned, I'm a staff nurse in an emergency room. I have seen both of these styles used in practice in different situations. I have personally used both depending on the situation I was put in. Picture this: a busy, nearly full emergency department, patients of varied acuity throughout the department, and a bolus arriving to the waiting room. Staffing may have been adequate if it weren't for the call-outs. Nurses were both mentally and physically exhausted. We got an ambulance patching in. A man in his 40s found unresponsive, CPR in progress. As charge nurse, my job was to allocate resources and motivate my troops. The situation was dire, and I was motivational, giving my nurses an end in sight. I had our secretary page out for additional nursing help, and they were able to come. The nurses gathered what little reserves they had left, and we tackled the cardiac arrest with ease. This was transformational. In other transactions at work, I used the transactional style. Consider the 40-year-old in cardiac arrest who arrived with CPR in progress. While coding him, I gave clear instructions on the care he was to receive. This is more beneficial in this situation where defined actions must happen quickly. My nurse supervisor at the ER I work at leads mainly utilizing transactional leadership communication. Typically, healthcare superiors do use this type due to the clearly outlined formal systems and procedures. In many cases, this is effective. While it sometimes limits personal relationship formation, it certainly promotes respect, and typically the direction of the leader will be followed, and there will be productivity that is sought by the leader. My nurse supervisor is effective in this style, though I can see the importance of utilizing both styles at different times with different communications. Thank you.